The National Continence Helpline is staffed by continence nurse advisors who are there to basically talk about anything to do with bladder and bowel problems. The nurses have a range of literature and resources they can send to people, so explaining about the different continence issues. We also have a service directory which allows us to talk to people and point people in the direction of where they can get help in their local area. The helpline operates Monday to Friday, 8 a.m. to 8 p.m. It's free and confidential. Basically, incontinence refers to the accidental or involuntary loss of urine or faeces, and over 4 million, nearly 4.8 million Australians have some sort of bladder or bowel health problem, basically 1 in 4. And about 30% of the callers to the helpline are men, which is why I'm there to talk to people about continence issues. In terms of what's normal for men, the important thing to remember that it's very individual. However, as a guide, men should drink at least 1.5 litres of fluid a day, and they should pass urine around 6 to 8 times a day and maybe once at night. The trouble is there's lots of variables: your age, what medication you're on, your lifestyle, whether you're an athlete or have a sedentary lifestyle. And the other thing to remember is people need to use their bowels for anything from, say, a couple of times a day to maybe once every second day. A good way to check if your bladder situation is normal is to look at the bladder self-assessment questionnaire on this website. In terms of what's not normal, incontinence is never normal and it is not part of the normal ageing process. However, age and associated medical conditions can affect bladder and bowel control in some situations. Even having to rush to the toilet just in case you don't have an accident is still a continence issue that needs to be addressed. So when people call, they say, I've got a bladder problem, but is it urgency, is it frequency, is it leakage, what exactly is going on? And the same when people ring about bowel problems, is it constipation, diarrhoea or something else? Constipation isn't normal and there can be many reasons why you might experience this, including diet, medication and lack of exercise. Finding the right advice is really important. So if you are experiencing bladder or bowel problems, the first thing you should do is to seek help to identify the problem and the cause by visiting your GP, your local continence service, or by calling the National Conitinence Helpline. It's really important to find the right health professional to help you. And once you connect with that health professional, they will work with you to complete a continence assessment, which will help to identify the issues and therefore the best course of management. So people will ring me on the helpline and say, well, I've got a bladder problem. I've been to my GP, they're not that interested. So I'll talk about doing a bladder diary, which is a 24-hour, say an 8 a.m. to 8 a.m. diary where you write down, on one page you write down what goes in, as in 8 a.m. tea 200 mils, and on the other page you write down what comes out, maybe 9 a.m. 200 mils, but you also write down what actually happened when you passed that urine. Did you need a rush? Did you leak? Did you have an accident? Those sorts of things. The other thing that might happen is that some other tests might need to be performed. We need to rule out that it's not a urinary tract infection. There may be some scans. They may need to check out prostate issues. Depending on your individual situation, some treatment options might include the basics like healthy bladder and bowel habits, making sure you're drinking plenty, making sure you're not constipated. There is a pamphlet called Healthy Bladder and Bowel Habits that you can download from this website. You could also examine your current medications with your GP for problems that might be contributing to your bladder or bowel issue, or you could look at medication that might assist with this condition. Seeing the correct health professional for your problem is really important, whether it be the continence physiotherapist or a continence nurse advisor or your GP who can refer you to the appropriate specialist. When men call the helpline, they feel very embarrassed about talking about bladder and bowel problems, but what's really important to remember is that if you do nothing, this problem is only going to get worse. So the important thing to remember to practice healthy bladder and bowel habits, and if you have a continence problem, just remember you're not alone, help is available, see your GP or call the National Continence Helpline on 1800 33 00 66.